Coming up on the Doctors Hospital podcast.
A lot of parents think that their child isn't able to function in a typical school if they have this label or they're going to get teased.
At the end of the day, we are trying to get your child to be as independent as they can possibly be outside of your care.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Welcome to the Doctors Hospital podcast. I am your host, Alexis Burrows, Marketing Director here at Doctors Hospital. So for many of our listeners, if you don't know, April is celebrated as Autism or recognized as Autism Awareness Month. And as a part of that, we are going to be having a number of conversations that speak to autism from a couple of different perspectives. So we're starting out the month of April with our speech language pathology team that work out of our rehab department here at Doctors Hospital. So joining me today on the podcast is Shanique Hudson and Krista Major. Welcome to the podcast, ladies.
Thank you.
Good morning.
Good morning.
All right. So we are going to have a nice lively discussion about both speech language pathology as well as autism and where those two kind of intersect and what that looks like. But I want to start out, as I like to do, with just kind of getting some background information on both of you. So can you explain how you decided to get into speech language pathology in particular? And we can start with Krista and then go to Shanique.
Okay, so I will give you the long and short part.
Okay.
I was in the 10th grade and I got introduced by a member in my church. She worked for PMH Rehab and she really wanted to kind of bring more people on board. We didn't really have many SLPs back then. So she just kind of educated me on what it is and what it, entails. And so I did some internships there during my last year of high school. And then I went off to COB where I studied psychology. And then I got the opportunity to go abroad and I was able to get my undergrad and master's in speech. So it really started out as a passion of mine because I wanted to do something that we didn't have in the Bahamas. Not many people are doing it. So I wanted to kind of tap into a field that was, wasn't very mass produced, I should say. So I really enjoy it. And it turns out that I really love working with both children and adults. So.
Awesome. Because I think even now there's only a handful of SLPs in the country, right?
Yeah, I think we made it onto a second hand already,
Okay.
but yeah, it's really not many of us.
Right.
Yeah,
Okay.
back then you could count on one hand.
Yeah.
All right. And Shanique, what about you?
So my story began in the 10th grade as well, but we had a college fair at my high school. And so we walked around to the different stations and then I saw this station with a speech therapist and she was kind of showing us what she was doing. And I was like, this is really cool. It's kind of like a blend between a teacher and a doctor. I kind of like this. And so I ended up doing my work study in high school at the Ministry of Education in the speech therapy department. And I was like, okay, yeah, this is definitely for me. And so once I graduated, I got into a program at the University of Central Arkansas. And I did my undergrad degree there as well as my master's. And then once I graduated, I worked for a bit over there. And I actually just moved home in July. So
Awesome.
yeah, very new back in the Bahamas. But yeah.
Is it the same person that you guys were introduced to or no?
I met Sasha Gardner. She was
yeah.
the one that was there at the time.
Well, I worked with a lady named Miss Boleg.
Okay.
Yeah.
All right. So that is like the 10th grade. I'm like, could it be that it was the same person as well? All right. So, let's go a little bit into, I guess, broad strokes in terms of, speech language disorders. So, Shanique, how do you assess and diagnose speech language disorders in your patients?
Okay, so typically when a patient comes in, we look at the background information and see what's the best course of action when it comes to assessing them. We have two different forms, standardized assessment as well as dynamic assessment. So just kind of based off of their attention skills and their listening skills, we would choose which one to do. So standardized assessment, we compare them to a lot of other kids at the same developmental age and see if they're up to standard, up to par. And we have a standardized score that comes out of that. Based on the score, we determine are they mild, moderate, severely delayed, things like that. Dynamic assessment is kind of the same thing, but we adjust to their level. So dynamic assessment is usually play therapy for a lot of our kids. Instead of sitting them down and asking them a series of questions that they won't be able to attend to, we kind of just incorporate it into play so they kind of don't know. We kind of trick them into assessing it. But comprehensively, we look at their language skills. We look at their speech and articulation skills, and then also their social communication or pragmatic skills, and determine, are they up to par? Are they up to level? Or would they need speech therapy?
Right.
And then go from there.
Like you said, it does sound like a mix between being a teacher and being a doctor. It's kind of cool. All right. So Krista, let's go a little bit into the autism conversation. So how does speech language pathology intersect? Where does that play when it comes to autism spectrum disorder? Like what's the interaction? How are they related?
So as you guys know, autism is a spectrum. So there could be low all the way to high. So is a child able to speak? Are they nonverbal? So you kind of have to, like Keishanique mentioned, you have to assess to see where they are first. But our role as an SLP is to kind of see what the child can do. Can they communicate? Can they express their wants and needs? Because that's the main goal. Trying to make sure that communication is functional. So where we would come in is to kind of see where the child is able to communicate. If they're not able to communicate, finding the best means of communication. It could be a nonverbal communication device. It could be a verbal communication device. So a lot of kids nowadays have access to tablets. So those methods of communication assist them. And we're here to kind of show them and kind of guide them into what's the best way to learn how to use this device or learn how to maybe sign language, whatever way is the best way that they're able. And no child on the spectrum functions the same. So you have to kind of, once you do the assessment, you'll be able to kind of see what they are able to do and go from there.
Okay. So what are some common communication challenges that someone with autism might face? And how do these challenges differ across the spectrum? So we'll start with Keishanique and then go to you, Krista.
I think one of the biggest challenges that we see is that social communication part, where they have difficulty upholding conversations, difficulty meeting people, eye contact, joint attention, all of those things that you would typically see with a typically developing individual, where you can connect very easily to them. People with autism have more trouble with those things.
So those are all great facts. And in addition to that, so in terms of their social emotion, some kids may struggle with being able to, like she mentioned, give that eye contact. So are they really listening to you? Do they really understand what you're saying? So you kind of have to figure out how is this child able or best able to understand, and function in society as best as they could, whether they are going to a typical school or are they going to a school that has special needs kids in their classroom. So kind of working on those challenges as well.
Okay. Yeah. So I have a quick question, because both of you mentioned the idea of eye contact. So what if a parent says, well, that's just what kids do. Like kids don't really like to look at you in their face when they're talking to you. How do you kind of get beyond that in order to really see if it's something that is normal or abnormal, I guess, in terms of like particularly the eye contact thing?
So I think it's kind of just seeing the level of eye contact, because I don't expect you to stare me in my eyes for 30 minutes of conversation. That's definitely not the goal. So we definitely need to look at, are they able to look at you at all? Because you would play with a kid, interact for 30 minutes, an hour, and there's zero eye contact.
Gotcha.
And it's very important to have eye contact and joint attention because that's how you learn new skills. You have to look at me to see how I play with a toy, or look at my mouth to see my facial expressions, all of these things that people with autism do have difficulties with, like emotional regulation, like Krista talked about. If we're interacting and you're not looking at me to see how I'm responding to your behaviors or your communication, you won't know what's appropriate and what's not appropriate.
Because a lot can get lost in not actively looking at and being engaged with what someone is doing as they talk.
So it's all about educating the parent on what's appropriate and what's not appropriate.
Okay. Can you also then share some strategies or interventions that SLPs use to support communication development in individuals with autism?
So I think we mentioned earlier about communication devices. Those are really good tools. So once being assessed for the communication device, or using your nonverbal skills, as in sign language or what have you, being able to utilize those strategies at home, making it more functional. So a lot of parents should, be aware of the techniques that you are working with the kids, and kind of utilizing it at home. So it's more than just using it during therapy, and we're teaching you these strategies on these interventions, but also applying it to your everyday life. So once we, the child is home, and whether we're giving you homework or we're giving you activities to do, it's really important that you do them, because that's the way you will really see the most success.
Okay.
And then to go kind of piggyback off of that, when it comes to the actual intervention, a lot of our strategies are play-based for that age, because that's kind of what they will attend to at the time. So I encourage parents all the time, play with your kids. Like, it may seem silly to you. It may seem like, oh, I could leave them to play by themselves. But that is how they learn at that age. Play is what they learn through.
Right.
So I encourage them to play with your children. And when you're doing so, there are a lot of different strategies that we like to tell you to use, such as pausing. So when you're playing and you say a sentence, the ball is going down, and kind of just like using those different strategies to get the attention from your child, and also model what they're supposed to be doing and what they're supposed to be saying as they're playing.
Okay. So can you, I guess, looking at autism, obviously this is something where over time, as we've learned more about it, it's something where we're able to kind of diagnose it and pick it up earlier. Can you speak to the importance of early intervention for kids with autism? And then how does SLPs contribute to early intervention programs?
So early intervention is very important, especially if a child has a diagnosis already. It's best that they get into a program, whether it's PT, OT, speech, so physical therapy, occupational therapy, and speech therapy. It's really good to have them start early. So, and these are all things that Keishani just mentioned about the play-based. So a lot of things that we may not realize is so common, playing with your kids, rolling a ball, blowing bubbles. All of these things are really good early intervention strategies to work on with kids on the spectrum. So kind of get them into the eye, using their eye contact, being able, that joint attention, being able to attend to a task for like a minute or two, things that may be a struggle for kids on the spectrum. So all of these things that we would work on in early intervention programs, they turn out to be very useful in building up the language for kids, and expanding on what they may have or lack thereof at this time. So going from there.
Okay, so y'all have me stressed out with this eye contact thing. So no, because I guess I think about myself and just like, and I guess just other people. You have conversations with people even as adults, and sometimes people struggle with eye contact. So is it indicative of someone possibly being on the spectrum, or is it just because, people have experiences that lead them into having anxiety and conversation and things like that. So how do you kind of differentiate between if it's just hey, this person has had kind of a rough upbringing, or they have background, it kind of leads them into a space where they're not comfortable in conversation and therefore they have challenges with eye contact, versus if someone is on some space on the spectrum?
So I know eye contact is a big thing with autism, but it's not the only thing that we look at when it comes to that. So based on the DSM-5, there are certain criteria that they have to, meet in order to be diagnosed with autism. So usually the school psychologists or pediatricians, they would be the ones to diagnose them with autism. But I know that there's also the pervasive or repetitive behaviors that they look at to make sure. So we call it stimming. So flapping the hands or like doing things over and over again, like very fixed interest on things. That's when we kind of look more into autism versus someone just having social anxiety or just having a social disorder, because that's something to social communication disorder, which is different from autism, but still another disorder that you may have.
Okay. So you mentioned there that pediatricians are often the ones that diagnose it. That kind of leads me naturally into our next question. How do you collaborate with other healthcare professionals, whether it be physicians, people in education, even other arms of rehabilitation, so other physical therapy services, to provide comprehensive care for your patients?
Okay, so once the kids come to us, because a lot of times parents see that, okay, they are not talking. And so that's the biggest thing for them. Why isn't my child talking? Why aren't they communicating with me? So we are often the first professional that the kids interact with. And based on what we find, we look at their communication difficulties, but we also look at other things such as like, are they walking funny? Is their balance off? Do they have difficulty with sensory regulation and emotional regulation? So when it comes to balance and walking, that's a physical therapist's job. So I automatically know I need to refer to physical therapy, see if everything's okay over there. And then when it comes to that emotional regulation, sensory regulation, or even activities of daily living, like they're not able to get themselves dressed and they're 5 or 6. Like those are tying your shoes at certain ages. Like, that's something you should be doing right now. And so I'd refer to occupational therapy for that. And also behavioral therapy. Kids that have a hard time attending and listening, throw lots of tantrums, we'd refer to behavioral therapy. And then just generally, if I see a lot of those signs of autism, I would refer to a school psychologist or a pediatrician, someone that is, able to diagnose with autism so that they can have all the resources they need.
Okay, awesome. So it's been a great conversation thus far. We'll take a quick break for some words from our sponsors, and we'll be right back on the Doctors Hospital podcast.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. 3 advanced facilities at Collins Avenue, Carmichael Road, and Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
All right, welcome back to the podcast. Let's just dive right back in. So, what are some misconceptions that people may have about communication difficulties in individuals with autism, and how do you work to dispel these misconceptions? We'll start with you, Keishani.
I think a lot of times we see people, they kind of assume that individuals with autism don't really have the ability to learn anything more than where they are. And so it's all about education, honestly. And something like this podcast is perfect because we're getting more information out there about what autism is and how we can help and how you can, provide the best support to those kids. So I think that's just the biggest thing. Education. Getting information out there to the public.
In addition to that, I think a lot of people believe that persons on the spectrum, they're not able to either ever speak or ever communicate. So that's a big misconception. And like Keishani mentioned, a lot of it is education. So being able to allow parents to kind of come into the session or be a part of the treatment, you kind of show them, a different way. So that misconception may be whether it's their family member or any other type of relative or friend. They might not know that, children on the spectrum can, communicate, whether it's, like I mentioned before, non-verbally or verbally, but there is a way for them to still communicate and function in society.
And I think another thing that we were talking about earlier is that there is a spectrum. So we a lot of times focus on that lower end of the spectrum where their kids are not as functional as they could be, but there's a higher end where kids are talking at super high levels and reading super fast, things like that. And we miss the social communication part. So that's something that we can educate about too. When it comes to that social communication, that's a really big thing. It's not only about speech and language.
Right. Okay, so speaking of misconceptions, I mean, I think one of the things that we probably should address is, we know that in our society, there's a lot of stigmas around being labeled with any number of diseases and disorders, right? And we know that it's the same thing with autism, things like Down syndrome, things like that, especially when it comes to kids.
Yes.
So what would you say to a parent who has, maybe gotten a diagnosis for their kid, but is, living in a space where they're in denial, they don't want to accept it, they're saying, don't label my kid that way, or, they're just going to grow out of it. What would you say to a parent who's in that circumstance?
So I would definitely say don't be ashamed. Don't be afraid to reach out and get the assistance that you need. We're professionals, and so we see this kind of thing all the time, and we're here to help. We're not here to make you feel any negative emotions regarding your child. We're here to help and provide the support. The label provides access to the resources that you need. A lot of times you don't get to even get into an evaluation unless you have a referral, which means you have to get a label, you have to get the diagnosis in order to get access to these resources. So don't be afraid, and just understand that we're here to help, we're here to provide these resources. And at the end of the day, we are trying to get your child to be as independent as they can possibly be outside of your care. Right. As they grow, they're going to continue to rely on you as the parent. If they're not getting the resources that they need, they're relying on you to help them through life. And after a certain age, that's not, going to be appropriate anymore. They want certain independence that they're not going to be able to have. So reach out and get the resources that you need.
Yeah. In addition to that, like we mentioned, don't be ashamed, because a lot of parents think that their child isn't able to function in a typical school if they have this label, or they're going to get teased. But it's better to know than to not know. As we mentioned before, you are able to have access to certain resources that will benefit your child in the long run. So you have to think about the future for your child. Like we mentioned before, that your child is going to be here, let's just say, way longer than you are.
Right.
So are they going to be able to, walk to the grocery store, drive to the grocery store, be able to take care of themselves? So you have to think about it. Exactly. So it is a safety thing as well. You have to think about, the future and not just the here and now.
Right.
The label is, it really is just a label. It doesn't mean that your child isn't going to be able to be successful in life.
Exactly.
It just means that they need additional assistance so they can be able to, function in society along with everybody else.
Yeah. Exactly.
And obviously, we mentioned this already, the idea of early intervention. The earlier the earlier you can start treatment.
Absolutely.
And potentially avoid a lot more complications if the child was to develop without getting care or treatment for the disorder. All right. So that takes us into our next question. We've been talking about this a lot from the standpoint of kids, obviously, because I think that's where most people's mind go when they think autism. But how do you approach working with children versus adults when it comes to speech and language disorders, whether that be from a result of autism, from a result of a physical injury? How does that approach vary depending on if it's a child versus an adult?
Okay, so this is a good question because we do work in the hospital setting. So we see a lot of children versus adults. So the difference is with any patient, you have to kind of see where they're at. How are they best able to communicate? So with a child, it may be more, play-based. to kind of build up some language. Whereas an adult who might have had a stroke, and they might have something what we call global aphasia, where they're unable to express their wants and needs, and or their receptive language might have a bit of difficulties there as well. So you kind of look at both ends, kind of meet the patient where they're at, and you move forward with your approach into treatment. So whether you are working, like I mentioned, play-based, or you are kind of getting that adult patient to communicate with their family member a little bit better they might need pictures to communicate. They might not recognize family members. So bringing in pictures of relatives would be helpful, kind of going through everyday routines that they might be doing that they might have been able to do before. So it really varies in that way. But the end goal is, how does this person communicate, and how are they best able to tell their family member, I'm in pain, I'm hungry, I'm tired. Yeah. So functional language skills.
Yeah, definitely all about the functional communication, whatever they were doing in their everyday life as it relates to adults. We're trying to get them as close to that level as possible, just whatever's most functional for them. And then another thing is the swallowing aspect. We don't often talk about that, but we also deal with the swallowing disorders in the hospital, and even in outpatient settings where you may have had a stroke and now you have difficulty swallowing food. So we have to change your diet. And I mean, recommend a certain diet to be changed for the patient. So all of these, that's something else. Like a grown adult, he's used to eating his steak and he's used to eating his pork chops, and now he's on puree diet. So he's eating applesauce and cream of wheat and things like that. So it's all about whatever is functional for you until we could get you back to your regular activities of your life.
Yeah, you can't exactly have cream of steak.
No.
Actually, you could,
Yeah, they do have
those
those molds.
Yeah.
It's not the same.
I mean, you might not enjoy it, but it's
there.
the same.
Yeah, I guess nutritionally it's the same.
Yes.
All right. Okay, so let's talk about outcomes. I imagine in a space like this, there's a lot of potential for very rewarding engagements with patients.
Definitely.
So can you talk about a successful outcome or a patient that you've interacted with, and just kind of like the strategies that you use to help them, and what it feels like coming on the other end of helping somebody navigate through a speech or a language disorder? So we'll start with you, Krista.
So I would say, I have a lot of positive, memories, I would say, but one I would talk about is an adult patient that I had, and they did have global aphasia, so they weren't able to really communicate. I think that was the most rewarding part of my job, is to kind of see them going from nonverbal communication, or I should say lack of communication verbally, and, kind of building off of that, where they're able to give short sentences and phrases to kind of express their wants and needs to their relatives. And then also, transitioning into them being able to do things for themselves. So I think that to me is most rewarding, because you're with these patients and you see them from the beginning, and you might see them from the day that they enter into the hospital until they reach into outpatient, and then you continue working with them. So it's a journey, but it's really rewarding to kind of see the transition.
Okay. And I'll go based off one of my kids that was diagnosed with autism. And so when they first came in, very like no functional language, throwing a lot of tantrums, kind of crying the entire time. And so it was kind of difficult to even build that rapport, to even get started with targeting their speech and language goals. And so to see them go from that, where we're crying and throwing tantrums, throwing themselves on the ground, to actually like requesting with sign language and then pairing it with a single word. Like sometimes it seems like a small thing for others, because we're used to just this consistent flow of language and communication. But for a patient like that, to see them come from so far into being able to actually use language functionally and communicate with me in the session to request things that they want, it's such a beautiful and rewarding thing. And parents, even seeing the parents' reactions to where their child has come from and being able to connect with them on on another level, it's really beautiful.
Yeah, because I imagine, as a parent, if you have that sort of a circumstance, even just being able to feel comfortable that you can communicate with your child.
Exactly.
And that you can feel comfortable that they're also able to communicate back to you coming from, like you said, a situation like where that patient started. I imagine it's a very beautiful thing.
It
because
really
now
is.
you feel like you have a much different approach to life where you can actually have communication back and forth. And I imagine for you being involved in the treatment and the care and kind of getting them from point A to point B is an amazing feeling, I'm sure.
It is. It really is.
So you mentioned patients, and I'm, again, considering that a lot of this is viewed through the lens of, kids with autism in particular, how do you ensure effective communication and collaboration with not just your patients, but their families throughout the treatment process?
So I think I mentioned it earlier where we allow parents to come in and kind of get a flow of what the goals are and how we are actually achieving these goals, what treatment methods that we use. So that's the first step, is to make sure that the parent is on board with these are the goals. This is where what we want to achieve with the patient. And then moving on to kind of allow them to learn. So they might learn, observe us, watch us, and then it's their turn to kind of, interact and become a part of the treatment sessions. Because again, we want them to be able to take these methods and work with their child at home. So being able to collaborate with family members, it could be a parent, it could be an aunt, but just allowing them to kind of learn and be able to say, oh, well, at home, he prefers this. Can I bring that? Because you can bring stuff into treatment sessions because it's more realistic, right? So if they have a special toy at home, that might be something that they can use to request for what they want. You might get more out of them than if I was to just put blocks on the floor and then try to get them. They may not be interested in that.
Right.
So having the parent kind of, understand what the goals are, and then they'll be able to say, oh, well, this might work better for him. So, because like we mentioned before, every child is different. So we don't want to kind of cookie cut, each patient, each goal, and each child varies.
Okay. All right. So we'll actually end with this last question, and I'll pose it to both of you. How do you stay current with advancements in the field of SLP and incorporate new research into your practice? I know medicine changes and evolves over time, and I presume with rehab and rehab related fields, it's similar. So are there any new advancements, any new approaches, anything that's interesting that's happening in the field? And then again, that idea of research, how does that play into how you evolve your treatment of patients within this space? So we'll start with you, Keisha, and you can have first.
So in order to stay current, I think we have what we call continuing education units. And so for certain certifications that you have to do a certain number. So when it comes to ASHA, we have to do 30 of those hours. So like 10 every year. So it's a 3-year period. And so you're just either going to conferences or doing online certifications and watching new programs, treatment programs that have come out, and kind of just trying to integrate those into what you are currently doing. And it's all about trial and error, seeing what works, because no one treatment works for all kids. So while this may be effective for this child over here, I try it with another one of my kids and it's not effective for them.
Right.
And so it's kind of just trial and error, seeing if it works for this kid, if they fit with that program, and then moving forward with it. And if it doesn't, then we do more research and figure out if there's something else that's new that we can work with that child on.
Okay.
So so Keishanique mentioned about, you're doing the research, you're taking these courses, which is all very important. So like she mentioned, trial and error. So a lot of it is we're kind of seeing what best fits the child again, because not every child will adapt to that, research practice as best as the next one. So being able to kind of expand your reading. So you might read articles, but all of it, of course, is research based. So you might have an article that might give you a little insight on the spectrum, because as we know, there isn't anything out there concrete to say why are kids on the spectrum. What are the causes? So in addition to, like she said, everything is trial and error. I would say that would be the best. The best case for us is to kind of see what people are using out there, what methods, and just trying to see how to incorporate it into our sessions.
Okay, awesome. Yeah. This has been a great conversation for our listeners who, if you have a child or a family member who's been recently diagnosed or that you are aware is on the spectrum, how would they, and you think that they may have a challenge, how would they be best suited to get in contact with your team to provide care or assessments or anything along those lines?
Okay, so we are located on Collins Avenue as well as Cable Beach at Doctors Hospital Rehab Center. And you can contact us at 302-4636. We would also recommend that you get a referral from your doctor if you suspect that your child needs speech therapy. I always tell parents you are the advocate for your child. So you can contact your pediatrician. You can find out if they would recommend that your child get speech therapy. Now, often pediatricians normally ask you to wait. I always tell parents, if you really still feel very strongly, you can kind of work around that. So you might go to the walk-in clinic. You might have another physician that you know. If you can get a referral, just basically saying that your child is recommended for speech and language therapy, then you can bring that into us. Like I mentioned, we are located both Collins Avenue and Cable Beach, next to the Wendy's, Cable Beach Plaza. And you can also bring in your insurance. We do take insurance as well as self-pay. That's an option as well. So once we have those documents, we can just get you started with initial evaluation and then go from there in setting you up.
All right. Awesome. And you'll get in and get to see one of these lovely ladies and get some help with whatever speech language disorders you may have. So thank you again, Kate, Shanique, and Krista, for joining us on the podcast. This has been a very interesting and good discussion. And hopefully for those of you who are listening who, may have an issue yourselves, or you have a family member, a child, hopefully this has been helpful for you in trying to navigate that process and what it looks like. So thank you again. And we, as always, we ask you to like, comment, subscribe, and share. And we will see you back next week on the Doctors Hospital Podcast.
Doctors Hospital is reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctors Hospital difference. Book your next appointment at clinics.doctorshos.com.